Hello, everyone, and welcome to the EDS Empower Hour. My name is Christie Cox, and I am a board certified patient advocate, longtime patient with EDS, POTS, mast cell, all the things. And if you're like me, you've been searching for a long time. And in addition to my writing and blogging and trying to figure things out, sometimes I come across people or tools that are really helpful and I want to share. So if you'll bear with me, I'm going to turn on some slides and we'll get going. And tonight we're going to have a feisty conversation with our guest, Erika Warren, about AI in healthcare. So let me get my slides going. Bear with me just a second. Excited everybody is here. And let's see, can you see my slides? And if I turn them on presenter view, can you see those?
Yep, we're good.
Is it showing the full slide and not the,
Mm-hmm.
okay, great. All right. Welcome everybody. And we're going to talk about AI tools for people like us, complex patients. And, see if we can discuss some ways to research smarter, help get ready for appointments with doctors, and learn how to advocate like a pro without completely drowning in overwhelm of data, especially learning how to trust your data. Okay, so why AI, right? It's the reality for those of us that are complex patients. We're kind of DIYing our way through this. And, on average, it takes us 10, 12. I personally think that's really under an estimation of, what we need to get diagnosed. We get passed around from multiple specialists, who, if one helps us, they don't talk to each other. And, the little 15-minute, which, like I wish I had a 15-minute appointment. Sometimes I feel like they're 8 minutes, but, it's just not ever enough to cover what we need to talk about in our complexity. So whether you're dismissed or disbelieved, it happens repeatedly and, it's pretty overwhelming. We already feel, energy fatigued. And then when there's so much research to do, it's great if you have a tool. And so today we're going to talk about where AI can help kind of fill in that gap to research your symptoms or conditions, available to you 24 hours a day. Get those intelligent questions ready before appointments to understand like imaging reports or labs or medical jargon, and then to connect symptoms to like potential mechanisms, track these patterns, and be able to give you a sense of health agency as you build your own health narrative. So, AI in general, it's really good at summarizing research, helping you spot like some patterns or connect some dots. I personally think it's fantastic for prepping for appointments or getting a script, for me getting ready to go in and feel more calm and confident as opposed to anxious and, on defense, ready to defend when they dismiss me. Um, Again, explaining test results and, giving you a vocabulary so that you can level up to speak a little bit of that clinical language that helps you get taken more seriously. I think we all know whether you're for or against AI in general, it is not a good idea to let it try to diagnose you. I mean, it's not a doctor, no matter how many times it might be tested to take a medical board exam. And it certainly cannot replace a thoughtful human being that's been trained. Um, it can't know your full entire history. It certainly can't prescribe or treat or give recommendations for medications or anything like that. And it cannot be trusted to be 100% accurate. You've all heard about how it hallucinates. So you always need to verify things that you find in AI. And it certainly will never replace your care team. And we're going to go a little bit more into this, but like using AI safely, a few kind of guardrail rules is always, verify, cross-check anything against things like PubMed or like a patient nonprofit or of course your provider. Um, you always want to be sure that your privacy is protected. It's not like you want to upload your entire full medical record and just ask it, what do you think I should do? I mean, you have to use purpose-built tools with some privacy safeguards. Um, Vague prompts are not great because you're going to get vague answers. And so, the more specific your prompts can be, the better. Always watch for they call it the hallucinations because it can just really confidently look like it's stating incorrect information or linked to made up medical research that looks really legit. So you always have to check it. But, you know, these tools, when they're grounded in peer-reviewed medical research like PubMed and, things like that are safer than general chatbots. And then, if you can output something in AI, maybe it's a good place to start a conversation and not to form a conclusion, right? So it's something you could bring to your doctor and have a discussion. Now, add as a patient advocate, I use AI to help me, particularly like help myself or help other people prep for the next appointment. Like here's some sample prompts if you want to take a screenshot, explain my condition in a plain language and, help me understand the comorbidities and like why do they usually occur together? Or help me get my question list ready around this particular diagnosis at this particular kind of specialist and get, a few focused clinical questions that I maybe didn't think about asking. It can also help you, here's a great prompt to decode like a lab result, like my lab result was X amount of value, whatever, in the context of this condition. What might this indicate? Or what follow-up might be appropriate? And then, another prompt to help you kind of build your narrative, get a clinical symptom summary ready for that specialist you're going to see. Those are just a few ways that complex patients can use AI to prepare themselves to have more empowered conversations. We're going to get into this in a minute. And, like this is kind of like AI 101 that we're talking about. But, privacy in your medical data, there's several things you need to know. And, in general, AI tools, should be used with caution because um, and I'm speaking generally, but conversations can be used to train future learning models in AI. There's typically not like a HIPAA compliance, and it's not any kind of secure or protected. I don't recommend uploading your full medical record. Um, you certainly don't want to include other things that you wouldn't upload elsewhere, like your social security number or your date of birth. And, again, it can hallucinate. And output can really, really vary. Some safer ideas, just in general, and we're going to dive deeper, is, you know, find tools that have clear privacy policies or tools grounded in like peer-reviewed medical research that it pulls from, like PubMed, or, you know, use it to describe your symptoms in kind of like conceptually without a lot of identifying details that you might upload to it. Or for general questions to understand a condition, like maybe in the way that you might have previously used Google, you could use an AI tool like explain, Hashimoto's or whatever. Like, just kind of get some general information. But again, I suggest that unless it's a specific service that has some sort of privacy and, security, you don't want to upload your medical records. And so make sure that you're aware of the privacy policies, right? But our guest today is going to help us understand this so much better because this was just a really general, quick overview. So, Erika Warren is the co-founder and CEO of Inciteful Med. She's a mom, also a patient just like us, and a caregiver, and a technologist who's been in the space of social impact technology, starting, in education, then moving into activism, and now in healthcare. And she, like me and many of you, doesn't have medical training. But what's been consistent across all of her career is this love for building tools that empower the underdog, right? And isn't that like a perfect way to describe how all of us feel sometimes? And her personal experience showed her just how important it was and how hard health advocacy can be. So she co-founded Insightful Med to help people, particularly patients, access information they could actually trust. And she has a love for fixing what, she's going to explain to us then a little bit more is like information asymmetry. And, what if the monopoly on medical knowledge might just be over and that there be an AI tool or some that are safe and secure and private and trusted that the patient population, was the intended user and could help us. So she's going to educate us a lot more on AI in general and LLMs and all the acronyms that we need to know. So let's get her expertise on how we can kind of pull back the curtain of AI in healthcare and, some of the reasons patients should be excited about it, some things they should question. And I'm going to hand it over to her. So, Erica, thank you so much for being with us and sharing Insightful Med.
Of course, thank you for inviting me, and for the very kind introduction. I'm here, or I suppose more accurately, Insightful Med exists today because of this paper, um, the multi-detector CT features of pulmonary focal ground glass opacity in the Journal of Radiology. Whew,
That's a
like
mouthful.
if you understand what any of that means, like you are well ahead of me. But my technical co-founder, a man named Mike, found this paper while trying to make sense of a loved one's CT results. The medical team that had been caring for them had sent them home with no diagnosis. They had stabilized, that nobody understood what was going on. They only had some incidental findings from the plethora of tests and labs that they had done. And the CT had this incidental finding. They were told to come back in 6 to 12 months, return for a recheck and rescan. I mean, talk about getting dismissed. Like, I'm here to say it doesn't happen to only complex patients. It happens way more, unfortunately, than any of us would like. Uh, but I don't need to tell you how that feels and or what usually happens next, right? Mike started researching, but he had an advantage over us, regular folks who just use Google at the time. This was before ChatGPT. Um, he had an advantage. He had built an academic research librarian tool. He's a nerd. He really likes science. He likes academia. He likes connecting those dots and going straight to factual sources. And so he used that tool to find this paper, which suggested the likelihood, an 86.6% likelihood that his family member had cancer based on the specific criteria that the lung nodule in their CT scan had that was matched in this article. So they took this paper back 2 weeks later, and in a second opinion, they had confirmed stage 3 metastatic cancer diagnosis. Waiting 6 months to 12 months would not have been good. Unfortunately, this is not a unique or novel experience that patients go through, and they were incredibly lucky. If you could go to the next slide, please. In fact, this paper was published in 2012. It's likely that it wouldn't have made it to all the pulmonologists, especially in rural Pennsylvania where they were located, for another 3 years. By this point, this person's already been in remission for 2 years, so yay. Because the average time from breakthrough and learning something in science to actual clinical adoption when doctors start acting on the information is 17 years. Years.
Gosh,
Now,
that's
some of
nutty.
that, yeah, some of that is by design, right? Like, and some of it is a good thing. Science happens, papers go to preprint, it's reviewed, like we have rigor in the process. It won't be published for 2 to 4, maybe 5 years, but the bulk of that time, the other 12 years within that, are is actually due to how medical information flows throughout the system and how we have people that practice and go to school and then like go out into the world and staying, yes, we have, continuing education credit and relicensing sure every 5 to 10 years, but the the pace of research is 2 new journal publications every minute. Like it's quite literally impossible to stay up to date on all of the information that is coming out. If you can go forward, the knowledge system within that I just described is really flawed. I call it a push system. I came from a marketing background, so I think about this in terms of research gets published, it's sent to like in physical journals or an email to physicians who receive this within their specialty. They then have to read it at some point. Then they have to recall that they read it. And then they need to find it again to make sure that it's referenceable to you and review it for relevance. And those last 3 steps happen, somewhere in between the 8 to 20 minute encounter. So when you say it out loud, I think it's not their fault that they are operating within the system that's so time compressed, but it's also like very clear why they need help. And I would argue, like, who better to help than patients who are already doing research and have probably the biggest stake in the outcomes and incentive to get it right. So the average time, as I mentioned, is 17 years. This is sometimes called, like, there's a whole field of medicine working on this problem. It's called translational medicine. And in 40 years, it hasn't gotten better. It hasn't gotten worse, which I guess could be a sign of progress given how fast research gets published, but the time is not shrinking. My dad actually works in health informatics in his career. He's retired now. And in talking about this, he's like, "Oh, it's still the same." And I was like, "Oh, Dad, like that's terrible." Um, and as I mentioned, new research is constantly coming out and quite literally impossible. There's a study that showed that to stay current, the clinician would need 26 hours in a day. We haven't figured out how to clone ourselves yet to make more time. So this here is the problem. Go ahead. Yeah. So what I want to really highlight today in our talk is that doing research, if it helps you feel calmer, if you feel this pull to in uncertainty to find information, action is a proven antidote to uncertainty. Your behavior is not the problem. It's the tools that you have access to that have been created that cause a lot of the problem. And today's tools do not build trust, as Christie mentioned. There's you all know why these are problematic. What I think is sometimes fascinating to think about is why the incentives behind these problems or behind these tools exist in that way. Like, why wouldn't your doctor or your health system want to put really great personalized information in my chart? Well, that increases their liability and like compliance issues. Like every one of those pieces of content has to be approved by a legal team. So it makes it clear then why they're kind of generic and not that helpful and kind of outdated, right? It's like all of these systematic pressures within healthcare cause the tools that we rely on to be less than what we would hope for. But Gen AI has changed a lot of that, and it's clearly like the talk of pretty much any publication that you open. It seems like I can't go a day without getting an article served to me about the risks or the rewards of patients using these tools and managing their healthcare. So, what I really want to do is not necessarily tell you to use them or not. I want you to understand for yourself how they work so you can decide the risk and reward. And I wish actually the articles like did this for you because I don't think it's particularly helpful to just tell people what to do or not to do. That doesn't usually work. You need to explain why. And if you explain and educate, then people become a lot more curious and can be more cautious. So let's go forward. Let's do a little bit of an explainer on AI. Okay, basic nomenclature. I'm going to go through this because I want to get to a lot of Christie's questions here. But artificial intelligence is a very broad category. We use it all the time and we hear AI. A lot of tech falls into this. It is not a very helpful term. Everything from like your social media algorithms have AI in them to like uh, a lot of financial tools have AI in them. Again, this is sort of like a catch-all term that is not very descriptive. A subset of artificial intelligence of AI is called generative AI. And what that category is focused on is things that create content. Content can be video, text, music, images, movies. Like, again, anything content related, computers can now artificially create it from basically copying existing materials and using that as inspiration. LLMs, large language models, are a subcategory of generative AI. So they generate things. You ask ChatGPT a question, it generates a response. But large language models are specific to text. And so what they do is they are trained on text data sets to understand and model human language patterns. All LLMs are Gen AI. Not all Gen AI are LLMs. Again, it depends on the type of content those models are making. And then the last piece of nomenclature here is training versus tuning. You hear a lot about this. Are you going to use my data to train your model? What the heck does that even mean? Again, because this is basically like turning language into math, into a map, what these tools do is they go and find all of the content that they can possibly get their hands on. Illegally pirated content, copyrighted content, everything scraped from social, everything scraped from the internet, open access information, like you name it, it trains on it. It wants to study how words are related. And that is what's called training. That's what it's doing. How these words relate to one another. And they use that to create general knowledge, like how it thinks, in quotes. Tuning adapts a specific model for a specific task or domain. So if you can think about this in the case of medicine as an example, the word positive means something completely different in medicine versus in the rest of the English language context. So medical LLMs sort of tune for those types of nuance. Now that you understand a little bit of this, you can sort of see why these tools are agreeable and why you get certain outputs because that's what they are training to do. Like they're trained to do. They're trying to guess how you want to respond. So let's go to the next. Yep, here we go. So despite the generalized data sets here, what I really want to explain, and this is important, is that LLMs really want to understand human language patterns because they essentially work, this is a simplification, but like a really sophisticated autocomplete. Like I said, they study how words in different languages are sequenced and paired together. And they basically turn that into math to then predict the next word in a sentence based on how they normally flow together. These models are really good because, as I mentioned, they've been trained on all the content that exists pretty much over the course of time. These tools cannot think or reason, despite being deep reasoning or called those types of tools. They do not know if something is right or wrong. They cannot verify facts or links. Their job is to confidently guess, that's what probability is, to generate an output based on your input. And when the source material is all of the internet, the good, the bad, the ugly, uh, you never know what you're going to get. So here's a quite, as a literal example. This is how it works. You put in a word and it just loops back on itself. The cat is the next likely word to be is again, is it black, green, is the sentence ending. It assigns probabilities to each of those words. So you can say good and it's say is it good day, good morning, goodbye, good afternoon, good job, right? Like it depends on the context of all the information that's around it. That's how it's guessing. And that's why it seems like it knows what it's talking about. And then sometimes you get a thing and you're like, what the heck was that? It's like when you see those, you can understand a little bit of how this works. And I just want to demystify this because it's not magic, it's math. Um, and it's also why using these tools for things that you don't actually know to be true or you can't verify yourself can be really dangerous because it sounds right. And it may be right. So if you go to the next slide, um, I don't want to undersell it, right? They are I mean, they are the best tool we've had in the history of patients having access to medical information. They do have, this is dated, this is from 2023, so these numbers are only going to be getting better where accuracy goes up. But for complex patients, for nuance, it can be hard, and especially hard if you don't already know the answer. So when I use general LLMs like ChatGPT, which I use every day, I use it for tasks that either are low stakes, like brainstorming or content generation or edit this or make me sound smarter and like more concise. I don't use it to say, explain to me how Artemis 2 is going to the dark side of the moon. Like, it's not going to be able to do that. It wouldn't know that. That's too recent, anyways. Okay. With all of that being said, next slide. The tool that I created and then my co-founder Mike created is not an LLM. It looks like an LLM because that's what people expect, and we want to match people where they are in uh, how they expect tools to work because it's hard to learn something new. But what we essentially do is we use LLMs for their strengths, and then where they're weak, fact-finding, research, citation generations, we use our own proprietary library services. The tool that I mentioned that Mike had built before that he used to find that article. It's a tool that we've been building on top of and really helps patients. It's used right now by researchers and academics around the world. It's been cited hundreds of times itself in publications and research as being a tool that they've used to discover additional research and link with other institutions. And we basically package it up so it does all of the work behind the scenes. So when you ask a question, we can confidently show you an answer with a citation, the exact excerpt, and a link to the original reference. So you can see transparently where this information is coming from, as well as verify it and share it with your care team. So that's a little bit about it's hard to judge tools. It's important to be able to understand and ask questions about how they work. And I think Christie has a bunch of questions teed up for me. I have another slide that just shows you what this looks like, but we don't have to cover into a lot of detail of this. You can see here there's a question and all the stuff that we can try. So
Yeah,
anyway,
so let me thank you so much. Let me stop the share and pull up these questions. Bear with me. Let's see. Is it showing the slide? What's it showing?
nothing.
Okay. Is it showing like you and me?
Showing your face, my
All right,
face.
good. All right. Our face is good.
Hmm.
All right. So some questions here. Um, First off, for anybody that's kind of actively listening in this, are you guys using AI like for your healthcare related things? You could put, like put yes or no or a thumbs up, something in the chat to let us know. Yeah, we're getting some thumbs up. People's people are using it. Um, but we also kind of are all trying to figure out, how safe this is, right? So, you know, skepticism is on point.
Mhm.
Um, so, Erica, if there's, people like us in the community that have been dismissed or misdiagnosed or even gaslit for years by, healthcare systems that were like designed to help them, it's very hard to trust another system, like even if it's AI. What are your thoughts about that? Like, just kind of opening our aperture to trust.
I'm not sure we should be, to be honest. I think our aperture and is on trust is about to be taken advantage of more and more, unfortunately. Um, there's like a debate on do younger generations even care because they've already been desensitized to be the skeptical and not trust anything, which is also like terrifying. But I think healthy skepticism with curiosity is the right balance. And so, what I look for is, and what I think about to build trust with anything is the transparency. What are the motivations behind this tool? What are the data sources? How can I verify? How hard is it to find answers to these questions? Um, things that don't have uh, things to hide that aren't doing shady shit uh, should make that pretty easy or be able to answer those types of questions. And so that's what I would do if I was trying to really like go deep on trust. You also need to consider, right, like, are you open to actual behavior change and like having some sort of discipline? If you're gonna say like, well, you know what, like I'm gonna look anyways and I understand the risks, then you're fine. Like, proceed, right? It's really a matter of what are you hoping to get out of this and what are you going to do instead? Like if you choose to not trust this, are you going to use another tool? Are you going to contact your doctor? Like what are the alternatives? And that's deeply personal. There are
Yeah.
tons of people, even in my own circle, that are like, I get what you're doing, and like, no thanks. I just listen to my doctor. And I'm like, that's awesome for you.
I
I'm
hope you
not
have a
wired
doctor
that
that listens and,
way.
communicates. Yeah. See, I'm an information seeker. I'm a researcher. I want to
Yeah,
understand
same.
the why behind what's happening and how it's connected. And so,
Yeah,
I have always liked, Dr. Google and,
yeah,
knew that there were things that I couldn't trust about it. And, somebody's got in the chat here that they use Dr. Grok and Enoch, which is, I mean, so there are a lot of tools out there. One of the things that we're going to do as a follow on to this is I have a little ebook that I called the AI Spoon Saver that was kind of like how to use AI in your healthcare, and it's got like a comparison chart of the different like ChatGPT versus, Gemini and Claude and these things and like what are good things to do with each tool. So we'll share that later. But
and
you know,
competition is good for patients. For us, more tools means more transparency, better access, more information. It just pushes evolution. Where we lose is when all of the information is gated. So I think like I welcome like the more the merrier. Let's see what we can learn from and see how who survives and yeah, I think competition is great for patients.
So, like, some more questions for you, Erica.
Hmm.
If the patient is kind of like in a spiraling, or they're hypervigilant or over researching, like, can a tool like this, like, accidentally like reinforce that behavior? And how do you kind of personally guard against it where you're not like obsessively researching your own situation?
Yeah, I'm going to answer this from, and most of these from Insightful Med perspective, because it's too hard for me to like try to decipher what's happening in some of these other tools, especially when we all use different ones. Um, we've been very intentional at keeping all of the outputs objective and factual. Like somebody recently gave feedback, they're like, this is robotic, like, or I don't agree with this. And I'm like, yep, like think of it like a friendly librarian. It has no opinion. It isn't it. It is not a thing. It does not think. And so it will not agree with you or follow your lead. Um, that said, some of the research is hard to read and hear. Like, if you are a patient diagnosed with heads, right, and your average, or not even diagnosed yet, your average time to you read and you suspect it, and you read that the average diagnosis is 12 years, that is not going to make you feel good.
Exactly.
Right? And I think we fundamentally believe that the first step of advocacy is education and information, but it doesn't stop there. So I spend a lot of time thinking about how do we take information and push you out of the tool. Not, it's not built for engagement. If you are using other LLMs, it's like, do you want it to do this and this? And like, how can I get you to stay forever? Because if you keep talking to me, I learn more language and that's how I get smarter. It's like the incentive behind it is not pure. It's not completely aligned with your output. And we try to say like, okay, you might want to learn more information, but at some point, like, you need to talk to your doctor, or you need to find a doctor, or you need to like do something different. So, how do we push you to action? And a lot of that action is not in Insightful Med.
Yeah, I don't know that we've said it explicitly, but Insightful Med, and for me as a former marketing person, I love the name because it's insightful
Nerdy.
with CITE because the only information that you pull from is PubMed, right? I mean, like it's
Yep.
not out there on the internet what Susie Q said on Facebook and then it gets pulled into an answer. It's medical research only. So it's like valid, researched, proven. So you're getting solid results. And like I like that like there's a little button that I can click and go read a summary of that particular thing or go read the full article. So as someone who's research and medically sort of savvy enough, I have a full appreciation for like how it works and the ways that I can offshoot or ask it to go to the next level or connect the next dot, and then I'm out, like
Yeah.
absolutely. Yeah. So tell us a little bit about some of the guardrails like that you've built into this, that like you're saying, other AI tools don't do, and what would Insightful Med never do?
Yeah, it will not reference something that isn't in PubMed. So our baseline information is peer-reviewed published medical literature. Every statement should have a citation with the full excerpt that it's referencing from the original source that is also linked. So it will not and cannot hallucinate a citation. Um, our promise is transparency for that verification. It can then also not be like give you dinner recipes. Like it's not going to like help you with other tasks outside of
Damn it.
medicine.
Yeah,
Yeah.
yeah, yeah. So it's not like a chaos engine and it's not going to keep me talking to it, which makes it really different from some of the other models like ChatGPT that's like, do you want me to do this? Do you want me to do that? Right? So there's a lot of other tools out there that can help you sort of summarize medical info, you know, that may or may not sound really convincing. Um, I appreciate that it can pull in simple and succinct. But, prior to all of this, I'm out there on PubMed, Googling, or I'm signed up for alerts for medical research on my condition, which is like, it's ridiculous that I'm a patient trying to learn the vocabulary of a
Yeah.
clinician to try to keep up with my own diagnosis, right? So tell me a little bit about how Insightful Med kind of bridges that gap between you just being overwhelmed by PubMed.
Yeah, so we actually process everything that's in PubMed into what we call thoughts. So you can think of them essentially as paragraphs. So when you ask a question, we don't go out and search PubMed like you do if you were using it individually. We go out and search the thoughts, and they're mapped to individual articles and the citations that all of those papers that reference it are related to. And so the power of that is that you are then able to find answers in literature that are very specific to either you and your conditions or your lab results or whatever your medical context is that you wouldn't necessarily be able to find but with just a general search on PubMed. We've kind of think about it as like inverting the research. Like research is done in silos, conditions are studied in silos, and their medicine is practiced in silos. But me as a patient, I'm a person. I have a body that's a system that's connected and have many things that are going on with it all at one time. I don't give a shit about the specialties or how medicine is organized. I care about me. What do I need to go find that's specific to me in the context that I am looking for? And so maybe I'm only researching something about heads. Maybe uh, I've said, here's my entire medical record. Help me understand what might be going on. And it'll say, oh, here are all things that have happened from your medical record and how these dots connect. Um, it can be very powerful in those in those ways if you use it as such. So that's a little bit of how it's like functionally different um, from just searching literature. And then it also explains it to you in like layperson speak. Uh,
That's my favorite part.
so the clinical stuff is there, and we try to do a pretty good balance of like keeping the words that matter because it is important to be sort of fluent or at least conversationally fluent in like what your disease actually is. But then we explain it to you. So you can say like, I don't understand. Explain it like I'm five, and it will. Like it can go further down in the path.
Yeah, I know one of the ways that it's been really helpful to me is particularly when I'm exhausted and I have a doctor appointment the next day and I can't really wrap my see, I can't even say it. My brain fog around like, oh my God, what do I need to say tomorrow? What are my questions? What am I even talking about? Like, why am I going to this doctor? And kind of just helping me get started. Like, I'm going to see this kind of specialist. This is what I have. This is what I'm concerned about, and it can help me like get those questions ready.
Mhm.
But what's been really impressive for me is okay, it can do that, but then it like takes it to this next level of it doesn't say it like this, but it's like, have you thought about this? Or, like, did you realize that this could happen? Or, do you have a diagnosis or XYZ? Or it's really common to experience blah, blah, blah. And it's like, it's helped me make connections of things that I had not even made, and certainly no doctor had made, because nobody's digging into my history like that. I mean, in any way, shape, or form. And so I've gone in with a better fluency and a better way to be able to ask questions that I didn't even know to ask, you know? And so, um, and I love, like I said, that it's in layman's terms, that it's in a way that I can understand it. It's not just like goobly gook. Um, yeah.
Yeah, I mean,
So
we build it for, as I mentioned, I'm a caregiver for my elderly parents. My goal is they can use it. So like they're my guinea pigs. I like give it to them and I'm like, does this make sense? Do you know where the buttons are? Do you know what these words mean? Like it's designed for people in their late 70s to be able to hold and not be like, what do I do? Like they want to, I want it to be accessible for everyone.
everyone. Yeah,
Yeah.
yeah. So talk to me a little bit about kind of the speed versus accuracy that comes in AI tools. Like, ChatGPT is throwing out an answer in 3 seconds.
Yeah.
And, I found that Insightful Med,
You're not even
like,
done typing and it's
yeah,
already
I mean,
responding. And I'm like, what? Like, I hit enter accidentally. Like, oh shit. Uh, yeah, we, ours is slower for sure. It takes time to search 42 million PubMed articles and terabytes of data. Uh, Not accounting for if you've connected your records, which is a whole other set that it needs to process and look for, and then understand how to come up with research questions specific to you based on what you asked and your data, and then do go out and do the research. And we are searching and then reconfirming and then making sure that the most relevant and the most cited. So we use within academia a measure of quality of a paper is how many times specific parts of papers have been cited themselves. It's like I describe it as 6 degrees of Kevin Bacon. I'm not smart enough of this, but it's like we basically want to know what are the what are the things that everybody agrees with. And so if you ask a question and a lot of results, a lot of thoughts come back that answer that question, we want to show you the ones that are the most credible. And so we use that citation metadata as part of that. So we're processing that in the background. If you ask a question that has an answer and there's only one, then like that's what you get. And you might read it and say, I disagree with this paper, or this is a low quality survey design that I think is flawed. Like, great. I can't solve science. That is how we move forward in debating that. We try to just find and show what is most of what's been published that exists. And then you can then have a conversation. This is how you build trust with your providers too. You can share back things and they'll say, well, actually, I don't think that relates to you because of X, Y, and Z. And oh my gosh, do you actually like find that provider talking to you like a human and answering your question rather than just being paternalistic and telling you what to do is helpful in building a relationship like I do? Like, so
yeah.
that's a way that you can
Imagine.
approach this in ways that they're like more responsive. So that's why it takes longer. There's a lot of stuff um, going
So we
back.
have a question here about, does Insightful Med like save your queries so you could go back into them and continue, or like refer back to that conversation or search or whatever?
Yeah, if you create an account, so people can ask anonymous questions. And no account, you just hit the website, ask your question, and off you go. Or you can sign up with a name and an email, and then your queries are saved, so you can go back and reference them. And if you have created an account, you're also able, we are not HIPAA compliant yet. It's in progress. I have to pay a lot of money for somebody to do an audit. It's not the tech that's hard, it's, the expense of getting a sticker. But if you choose, you can add medical records, and that's stored within the account. You can set up multiple patients, and the records are stored at individual patient level. So, for example, in my account, I have multiple patients. I have one for me, my son, my husband, my dad, my mom. We have all of our records in there. And so I can ask a question in my account and in my mom's account. I can ask the exact same question, and the answer I get may be different based on our medical histories. Like, we are obviously different ages. Like, she has different health conditions than me. We share some stuff, and so family history comes in, but the tool will save that and reference that across your research as well.
And it's all private, right? Like I have the opportunity say, for example, I do a search and I go, oh my God, I want to share this with my husband. Like, there's a share button that sends just that conversation, or I can print it and it'll print like that was what was beautiful for me was I could print it and bring it to the doctor. Like,
Yep. Yep, you can copy and paste, you can share a link, or you can print to PDF the information. You decide, you can revoke access to a link if you want at a different time. It doesn't have access to your records. They're read only. You're like if you share a link with somebody, they can't like jump on and collaborate on your thread. Um, it would be kind of cool.
let's
Sometimes
find out what's really wrong with
yeah, well, it's
you.
like they're
Yeah.
gonna be like, ah. Um, so yeah, all of that is possible. I use that functionality quite extensively. I was managing both my family members were in the ER recently and hospitalized, and I was using the share functionality to keep family abreast of what was happening and information were coming back via text thread. So it was like instead of constantly answering questions for me, I would just be like, new result, like posted, put into Insightful Med, explained, like in the context of what else is wrong with this person. Here you go. And it was just like a way for me to push out without becoming the bottleneck for everybody else because I was busy.
Yeah, yeah. So, most of the people that are either here or might be watching later are probably coming from, the audience that I communicate with. So they're likely complex. They likely don't have one thing wrong with them or one diagnosis. They have kind of like everything wrong with them at once. And we're trying to figure out what was the source of that little symptom that was going on. How does Insightful Med do at kind of like connecting these symptoms across multiple systems, like you talked about, the silos and the specialties. Like we're a body and we just want to know what's broken and how to fix it. And I don't really care whether that's neurology or musculoskeletal or cardiovascular. It's like it just hurts here. So
Yeah.
how does that work? How do you guys kind of navigate, getting your librarian to do that?
Well, all of it comes down to like I said, how information is stored around patients. So like people in different subspecialties end up studying and reporting on research of individual patient conditions, like populations with those conditions across papers. It might not be the point of the paper, but they're like, oh yeah, and we had a bunch of people that also had heads in this study about something completely unrelated. And now we're able to connect those dots. And a lot of that, again, it's there's a lot of medical literature over the history of science. So there's ways that it that we connect the dots. Where I think is potentially useful for this audience is a lot of the rare disease community can it will also help you say like who should my care team be like and so okay I am a complex case. I need to see multiple specialists. None of them specialize in this one thing, and because of how medicine is practiced, I'm going to be bopping around. So like who should be the core people on your team is like the first like way if you're just getting diagnosed, is a common question that I've seen. I've heard from rare disease patients talk about this. And so that's one way that you can also use it. We do something else where we publish specific guides, and I can share these afterwards on a disease. But one of the, like, there's one for EDS, and then I created a separate one for heads and POTS and MCAS. And on the last page, we show you who the most published authors are in the topic. And in something like rare disease, you can reach out to those people. Like you can send them a note. They love to hear from you. I had one person told me, "Oh, every time a new article comes out, I just message them and say thank you for continuing to do your research. I read it. I'm a patient. Like I live by this." And they're trying to incentivize continued publication by just saying thank you
And
to the
study,
people that have
yeah.
dedicated their lives to this. So anyway, we have a search on the last page of the guides that summarizes like the leading institutions, based on publication data, and the individual clinicians or researchers studying that, and then you can put in your zip code or your location and see which places are closest to you as well. And it shows you a cool little map and everything. So,
Yeah, if you have a minute while I'm kind of queuing up the next question, if you can, if not, we'll include it in like the after summary that I'll send out via email. Put in those guides for, EDS and HEDS and POTS and MCAS. And when we were talking about doing this webinar, and she told me that she had those patient guides. Um, it was like, okay, it took me 2 years to write a book on hypermobile EDS. And I think she put it together in, 2 hours. Maybe it was 20 minutes or 2 minutes for all I knew. But the part that was really cool to me was it wasn't just the things you always see, like here's how you get diagnosed and here's a diagnostic criterion or whatever. It because it was pulling from the research and the things that people were saying in the research, it was like people are commonly dismissed and, it takes a long time to get, here's the number of things it takes to get diagnosed. It dug so much deeper than kind of the general that, I was like, well, why do I ever need to write a book again? um,
well, you have lived experience that researchers don't. So, like, for sure, this is not meant to replace this. This is just a quick summary of the published literature, which is
yeah,
a completely different data set from what everybody on this call has and is often missing from a lot of the research as well.
yeah. I was
So,
going to say, like when I talk about my book, um, it's like it's one of the only patient perspectives that doesn't put it into like medical speak of, this doctor said that and this doctor said that. It's like, now this is what it's really emotionally like when you get chronic illness and your life gets wrecked. This is what you're going to go through. This is like the grief, and this is how to prepare for an appointment, and this is how to deal with the pain and things like that. So, sorry, I didn't mean to give a giant plug for my book, but next, let me go to some, kind of, I'll call them softballs. You know, AI tools like Insightful Med are solving like a technology problem, or are they exposing a healthcare system that was really kind of never designed for complex patients in the first place?
I would say not designed for patients, period. But
And probably never will be, right?
no, likely not. I
I
mean,
mean, you go to you like you were talking about applying for a grant before we got on here, and you go and it's like, oh, well, there's some seminar and conferences like patient feedback is the most important thing, but like there's not a single patient on the panel, right? I mean, like
yeah.
there's a miss,
It's
right?
wild to me, actually. This is the first time I've built something within healthcare. So I've spent all my career building tech in other industries, and like the concept of user-centered design, like understanding your actual customer and building with their feedback is like table stakes. And so I
Yeah,
talked to
it's
like a
bare
group
bones.
and I talked to Open Notes and I was like, oh, we should partner. Like, I believe in all this stuff. And they're like, yeah, we can like run on a survey and like a focus group and get you feedback. And I was like, I already do that. Like, I don't need to pay you to do, like, what do you mean? People pay you to give them feedback on their, like, why don't they do that themselves? And it was just like a duh moment for me as like a technologist who's only built like in pretty much every other industry except this one to be like,
Yeah, UI
my
is top,
gosh,
right?
like
Yeah.
why? No wonder that everything is garbage, and not built for us and solving our problems. Um,
Yeah,
yeah,
I know like
not a tech problem. It's a system problem.
right. I mean, like our doctors
Incentives.
getting nervous about this because, when a patient comes in armed with information, and the like you said, if medicine is not going to be an imbalance, that information asymmetry where, we have just as much access to information as they do, like what an imbalance this could potentially create. Are you seeing any kind of like pushback on your tool from like the medical community? Or, I mean, I know your tool is designed for patients, but what
Yeah.
are your thoughts on that?
Um, I personally know we hear from patients. I mean, I think it depends on how you walk into the room. and everybody on this call already knows that. Uh, if you're picking for a fight, you're gonna find one. But what we often hear is that the citations are the thing that give patients credibility, and when you drop the right words, all of a sudden everyone's like, "Are you a doctor?" Like you start getting you've triggered something in their brain that had them pay attention to what you said in a more critical tone or connected dots for them. And so it's been very helpful, and people have been appreciative and curious and interested providers in sharing the tool in sort of informal referral. I don't know how to rectify this, and I'm sort of grateful. Open evidence is a tool that is not dissimilar to ours. It does similar things. It's built specifically for providers. You need a license, an NPI number to access it. Uh,
Yeah,
and
you have to be a healthcare provider with that license. Like you
yeah,
can't just go there and start an account. Yeah.
and they, well, two things. First, started patient facing, raised a bunch of money, and were forced to pivot, raised a bunch of venture capital, and forced to pivot to focus on doctors because that's where the money is. That's where, and they're now worth 12, 16 billion dollars off of an ad model where it's free for doctors to use. The way that open evidence makes money is through pharma advertising in their product. They were asked, why don't you make this accessible to patients? And their answer was, doctors don't want patients to have access to this information. That is not what I am hearing. I'm not saying that those two things are two truth. They can both be true. I think there's certainly populations that may feel that way. But I have been pleasantly surprised. I was expecting it to be worse.
I think it probably boils down to, like an individual doctor that is open-minded that we're all searching for is going to be open-minded to a tool. The sort of curmudgeon that's like, nope, I own all information in the world, they're
Yeah.
not going to, right. So hopefully this is a
Yeah. I mean, some
cultural
people
learning process, right?
are using it to like educate, and many in this community do that too, like educate their team on this position. So they are thankful. They're like, wow, this is great. You just saved me a bunch of time. I can read this guide or the summary that connects these dots to me, and like I can use judgment. I'm a trained doctor, like to
Yeah, yeah.
decide if this makes sense or not.
Tool plus judgment equals wisdom, right? Yeah.
Yeah.
I
And
don't think I addressed this question, but somebody asked in the chat, any advice on like uploading literally several years worth of medical records, like
yeah.
trying to sort of understand your health situation. I mean, is it better to kind of like upload it chronologically, stick to actual records? Is it summarized results? Is it patient visits? Or is it just like bulk and let it figure out what it's going on?
It's up to you. We have the process where if you go into your My Chart or your EMR and you click download your entire record, it'll be huge. It'll be in a file that
It'll
you
scare you.
can't open. It's like code. And we have a way that you can just upload that, and our system processes it and stores it in the HIPAA compliant like medical, like it pulls all that out. I have done 10 years of medical history for my mom, since she moved and switched systems, and I didn't go back further than that. Another patient we had, I think, did 20 years. He's a cancer. He's been battling a metastatic cancer for that long. His file was even bigger. If you tried and it doesn't work, you should email me. I'm hello@incitefulmed.com. I'll drop it in the chat, because that helped. We're kind of always trying to find the limit for people that are interested in that. The other thing I will say is we are working on this right now, record automatic syncing. So we've integrated with another tool that allows you to connect your patient portal to Insightful Med, and so when you go to the doctor, anything new will automatically pull in, and you don't have to continue to upload.
Oh my God,
So
magic.
you can
Hmm.
really do however you want. If it were me, I'm lazy. I would just download the whole record, and try to upload it and see if it works. But you don't have to do that. If you have your summary that you take to your appointments, like many of you do, you could start there. The tool's
But like
intuitive.
you could
It'll ask you.
upload, a screenshot photo image of, like a lab result or an MRI report and a PDF of this, and you could kind of like piecemeal it and it would start putting it together, right? I mean, it kind of
Yeah.
doesn't matter, and it doesn't have to be like some clean, concise.
Oh yeah. I
You
mean, I
could
took a
you could just
photo
onesie
of a
twosie, yeah,
printout or of a screen when I was in the hospital and the doctor was like handing me stuff and I was like, whoop, like upload. Like, what does
yeah,
that say? Um,
yeah,
so it's just gonna exert te it can't read images. It's gonna pull out the text within images. So it's
yeah.
not gonna like read your radiology report. It's gonna read what the radiologist wrote in the notes. Um, yeah.
Yeah, but I mean, like, if I want to know, like, I did this today, like I got some lab result from blood work, and I was like, I have no idea what this acronym means or what this even tests, so I just took a picture and said, what does this mean? And it was like, oh, this is, blah, blah, blah. And this means, and your result is, in the normal range, which is this, and, whatever. So, yeah.
Yeah,
Um,
it can also track stuff over time. So like for again, if you connect your record to it, you can say like, what is my A1C level over history? And it'll pull it back for you in a table or show my ferritin levels, like whether they most the low, what should be the target for, a patient like me with POTS. Um,
Yeah, I don't
and
know if you're familiar with Guava Health, but a lot of us use that one to upload our records and, like track our symptoms. It's multitasking and it has some level of AI in there, but like you might want to talk to those people because I mean, it might
yeah.
be a good tool. Um, before I keep going on kind of like more questions, are there I
Mhm.
know we're over time and like are there people that have Q&A that want to ask directly? You're welcome to like come off mute or put it in the chat if you have some questions for Erica. Um, she's dropped in the guides. I have a couple of other guides while you guys are getting your questions together. One of them that I've found is called like AI in medicine, and it was put together by like a school, and it had some interesting prompts in here. Like one of them I was just telling Erica about is the acronym is TLIC, TLICC, which is kind of a foundational prompt for it telling you it's like a framework that puts it into doctor speak, and that those acronyms stands for like time, location, intensity, context, and change. And so it allows like the AI tool to let you speak like in a clinician way. So I'm gonna put a few links in the chat here, and it'll be included in the after um, material that we send out and in the YouTube link um, that I put out here. And then there was also an article in the New York Times just a few days ago about, doctors not being able to help complex patients and they turned to AI and the results that they got and the things that they did. So if anybody has any questions, feel free to ask them. I'm going to put a few things in the chat. Um, any other comments or anything anybody wants to share? It's a whole new world, and I think a lot of us were kind of afraid of Google when it came out. And, a lot of us were um, technology means change. And so, learning and getting understanding how to use it wisely, I think is really important. So it looks like Brittany, why don't you go ahead with your question?
Thanks. Hi. It's been really informative, and I've used the Insightful a few times when I get to know it more. But um, you basically answered most of my questions as you were going through your explanation. But out of curiosity, this sounds kind of expensive to run. So I was just kind of don't feel like you have to share. I was just kind of wondering like how it almost seems a little bit too good to be true that this is free. Not complaining, just thank you.
Yeah. Christy, was it you or was it somebody else that was like, "You're the worst business person I've ever met"? And I was like, "Thanks." Uh, yeah, it is free for now. It is actually less expensive than running an LLM because we are not generating all that stuff. We are like looking it up uh, and then summarizing snippets that are relevant. So a lot of the tech investment and time was stuff that we've already used. We give Insightful Academic, that's our like academic literature search tool used by librarians and researchers away for free as well. And this is sort of built on top of that for this specific use case. Our plan long term is to always allow, like, I should back up. The whole reason that we're here was that we were patients and we clearly understood the problem and we're frustrated that no one was building the solution. And when we got into here and we started talking to people, investors, people in healthcare, they were like, "Oh, this will never work. There's no money in patient tools or patient education. You have to change your approach. You have to like sell to doctors, you have to sell to health systems, you have to sell for insurance. Like the solution is amazing, but you," and I was like, "No, that's exactly the problem that we are trying to address. Like, I don't care that this isn't $1 billion idea. Like, I care that it helps as many people as possible, and we want it to be financially stable." My background, as Christy mentioned, has been working at public benefit companies that use crowdfunding as a way to pay it forward for other people to use. So our long term, our plan is to have a freemium version of the tool that works pretty much like it does today. And as we layer on things that make it much easier, like auto record syncing, then we will charge. Like we will charge a nominal fee to cover our costs, while still making it accessible to everybody else in the world that can benefit from it. My like personal ambition is to, well, there's three of us that work at this company, to be able to like cover our costs, to run the tool, to be able to pay my mortgage, to be able to hire a few more people, but not too many because I don't want to create an org chart and I never want to write a performance review again in my life. And if that is, if I can do that, then like I win. My metric, our metric of success is impact. And we measure impact through stories and people telling us and meeting their expectations in what they do. Um, and so we're intentionally not raising venture capital. I've been there, done that, lived that life. No, thank you. I don't want to do that again. And we know that they will make us focus on something else, which is why we don't want to do that. And so I'm like, we're applying for grants. We may go with like a philanthropic donor who believes in the mission and access. There's lots of different ways. We just haven't done any of that because the cost is not a lot at our scale. And we don't want to put that barrier for people that it can help when it's unnecessary. So long-winded answer. Um, I I do sometimes wonder, it's like, would we be better off charging? Would people take it more seriously? Does it feel too good to be true? Um, I don't know. It's whatever. It's helping. I was telling Christy today, we have 14 different languages that people have asked anonymous questions in. Usually the way that it works is like people ask an anonymous question, they usually ask a question they know the answer to because that's how they verify that this thing is like not going to make up a bunch of random junk and they can play with it. Uh, and then, some leave and some go on to create accounts. But I see some of the anonymous questions come in, and I'm like, "What language is that?" And it's just like, it makes me so happy to know that people from all walks of life are getting value and finding this thing. So anyway,
Yeah, yeah. I mean,
terrible business person. Don't believe healthcare should be a capitalistic pursuit, much less in education or information, where I've spent 15 years of my life. So, yeah.
Yeah, I mean, I certainly appreciate that. People say to me, like, why aren't you charging? Or why do you do this patient advocacy work? And it's like, because this is never about money. This was about helping people. And yeah, if I charged something or if I did that, then that other person would see value with it and would find me more valuable. But yeah, it's the
I
way
don't
that
know, man.
the
It's
world
just,
works. Yeah.
yeah.
Yeah. But I'm so thrilled to have had you here. Thank you so much, Erica, for your time and for your tool. And, like I feel like there's only going to be great things that come to you and what you're doing. And it's just kind of a matter of, getting the word out about this is a really great tool. And, whatever your fees that might come for features that come later, like people find value and a tool that helps them live their life better. And if they can have better healthcare experiences because of it and get better answers and, connect dots and all that, like boom. I mean, that's for people in our community, that's so huge. So thanks for coming on here and letting me, um, share it and have you explain the nitty gritty behind, what's going on with AI and how to use it wisely. So
Yeah, I appreciate it anytime. And if you try the tool, I'd love to hear what you think, how it helps, what could be better, what you hated. I'm game for all of it. And I have $0 for marketing. So the way that you help me is by sharing the tool with people in the community where you think it would benefit. Um, and yeah, that's really it.
awesome. All right, unless anybody has any last minute questions, thank you so much for joining us. If you're watching the replay, I'm going to try to put all these resources from the chat. And Erica has a good like PDF that guides you like how to prep for an appointment and things like that. And we're just going to share all that with everybody. Anybody else? All
Yeah,
right,
you're welcome to use the prompt guides. I try really hard. We've tried really hard to make the tool as like simple as possible. You can literally just put in heads and it'll work. It'll say, "What do you want to know?" It's interactive. So like please don't feel like there's a way that you have to hold it right or prompt it right. Like those are things that exist in the other tools and like that's not how people use technology. That's not helpful for patients. It's helpful to have guides that help you think about things and like so I'm happy to share them, but don't let perfect be the enemy of good. Just try. And you'll get the hang of it and you'll see and like again it's not going to hallucinate or make anything up that's not how it works so um you really it's really just try it out that's all I want to say, sorry to interrupt.
yeah, yeah. No, I'm just thanking you and just reminding everybody that the links to the guides that she shared and some of these other things will be in the replay on YouTube in the like description, and I'll put that in the Zebras Underground. If you're looking for information about EDS or hypermobility specifically, a website that I've put together that tracks PubMed and keeps up with the news and related things that are going on and it pulls in things from YouTube that is being shared by a select group of credible medical professionals, all on pages there. You can find that at edsjointeffort.com. And you can stay tuned for my Science with Sass, trying to be witty about how wacky this medical journey is on Substack at Zebras Underground. And you can share your story with Erica on Substack. She's on there. So, again, thank you, Erica. Thank you, everybody, for joining. And I wish you all better information to take better agency over your health.
Heck yeah, thank you.
Yeah. Thank you.
All
Take
right,
care.
bye.
Thanks. Bye.